How many of you cringe when you see the scale at the doctor's office? Yes, I hear you. It seems as though they can never get them calibrated correctly, right? Today we are going to look at weight and body composition assessment and why it is important. So why do we assess our body weight? First, it is a great way to establish a baseline so that when you are trying to make changes, you can create realistic goals. Assessing where you are when you begin helps you to document changes throughout any behavior change journey. Assessment helps to categorize risk of developing certain health conditions. And finally, assessment provides standardization when conducting research. When we are assessing our body composition, we attempt to estimate our fat-free mass versus our fat mass. Fat-free mass is made up of muscles, organs, the immune system, bones, connective tissue, and body water. Males and females differ in how much fat-free mass they have. But in a typical adult, about 85% of male and 73% of female bodies are made up of fat-free mass. Excess fat is stored in the body's cells until it is needed for energy. About 12% of male and 15% of female bodies are made up of storage fat. Essential fat is the minimum amount of fat needed to perform normal body functions. Essential fat is present in the nerve tissues, bone marrow, and organs, and we cannot lose this fat without compromising physiological function. Females need more fat than males to support reproductive functions. About 3% of male and 12% of female bodies are made up of essential fat. Now that we know what we are measuring, let's talk about how we can measure body composition. Anthropometrics is the measurement of body size and proportion. For our purposes, we will talk about height, weight, and circumference measurements. We can use these measures to assess our health risks associated with overweight and underweight classifications. We will begin with body mass index. BMI is basically a calculation of your height and weight. It is strongly correlated with total body fat. However, it does not measure percent body fat. Body mass index provides a measure of being overweight and obese rather than just weight alone, which helps to classify risk of chronic conditions. Hundreds of studies associate higher BMI with increased risk of chronic disease and premature death. BMI is not gender specific, and it is calculated by dividing weight in kilograms by height in meters squared, or weight in pounds divided by height in inches squared multiplied by 703. Here are the BMI weight categories. Underweight is less than 18.5. Healthy weight, we can also call this ideal body weight, is 18.5 to 24.9. While many charts identify this category as normal, I try to stay away from that terminology, which may suggest that those in another category are not normal. Overweight is 25 to 29.9, obese is 30 to 39.9, morbidly obese is 40 to 49.9, and super obese is over 50. As you have read, BMI is not a perfect measure because it does not directly assess body fat. Muscle and bone are denser than fat, so an athlete or muscular person may have a high BMI yet not have too much body fat. However, for the majority of people, BMI is a very good gauge of their level of body fat. Here is a body mass index table, which is the low-tech way to determine BMI. You begin by finding your height in inches in the column on the left. Then you follow the row until you find your weight to identify BMI. You can also calculate BMI using the formula we just reviewed or the BMI calculator found on D2L. Regardless of what your thoughts are about BMI, it remains the most widely used method to classify weight. Where you carry fat may be more important than how much you carry. Abdominal fat is more threatening than fat in other regions. Waist circumference is the simplest and most common way to measure abdominal fat. A waistline greater than 40 inches in adult males and 35 inches in adult females may be indicative of increased health risk. Abdominal obesity results in an apple-shaped body type, which is more common among men. Women typically accumulate fat around the hips and thighs to develop a pear-shaped body type, although they can certainly develop apple-shaped body types as well. Like the waist circumference, the waist-to-hip ratio is a measure of abdominal fat. Likewise, it has a good correlation to body fat. It's calculated by measuring the waist and the hip and then dividing the waist measurement by the hip measurement. A waist-to-hip ratio greater than 1 in males and greater than 0.8 in females indicates increased health risk. Body composition or percent of body fat can be measured in multiple ways. They vary in accuracy and accessibility. Keep in mind, in all of these measurements, body fat percentage is an estimate that is based on research conducted on cadavers. So it is a relative percentage of fat mass and fat-free mass. BMI, waist circumference, and waist-to-hip ratio all correlate to the most accurate measures of body composition. In skin fold measurements, practitioners use a special caliper to measure the thickness of a pinch of skin and the fat beneath it in specific areas of the body, such as the trunk, the thighs, front and back of the upper arm, and under the shoulder blade. Equations are used to predict body fat percentage based on these measurements. While this is a convenient and inexpensive method, it is not as accurate or reproducible as some of the other methods. It can also be difficult to measure individuals with a BMI of 35 or higher. Bioelectrical impedance, or BIA, sends a small electrical current through your body. Fat impedes or makes the current go slower, so it is a timed resistance based on height, weight, age, and sex. This method is fast, easy, and convenient. It is also less invasive than skin fold measurements. However, it is less accurate than other measures and is easily compromised if the individual is dehydrated. Underwater weighing, also called densitometry, used to be the gold standard for determining body fat percentage. In underwater weighing, the individual is submerged in water and weighed. Fat is less buoyant than water, so it floats. The individual's underwater weight is then compared to their out-of-water weight to determine body fat percentage. This is an accurate method, but is time-consuming. This method is most often used in a research setting. Air displacement uses a similar principle to underwater weighing, but can be done in the air instead of in the water. Individuals sit in a small chamber wearing a bathing suit. One commercial example is the Bod Pod. The machine estimates body volume based on air pressure differences between the empty chamber and the occupied chamber. This is safe, accurate, and can be used for all, including extremely obese adults, older individuals, pregnant women, and children. However, it is expensive. In the dilution method, or hydrometry, an individual drinks isotope-labeled water and then provides body fluid samples. The samples are then analyzed for isotope levels, which are used to calculate total body water and fat-free mass. From that, fat mass can be determined. Similar to air displacement, this method can be used for all individuals and is accurate, safe, and affordable. The limitation is that the ratio of body water to fat-free mass may change in individuals who are ill, losing weight, or dehydrating, decreasing accuracy. In a DEXA scan, two low-level X-ray beams pass through different body tissues at different rates. DEXA is typically used in a clinical setting for screening such as bone density and for body composition only in research settings. Finally, the current gold standard, CT and MRI scans. These two imaging techniques are now considered to be the most accurate methods of measuring tissue, organ, and whole body fat mass, as well as lean muscle mass and bone mass. CT and MRI scans are typically only used to measure body fat in research settings. The textbook lists classifications for body fat percentage for both adults and children. However, body fat goes up as we age, particularly around the center of the body, so keep in mind that the table in your textbook is just a guideline. Finally, while body fat percentage breaks down your body composition into fat-free mass and fat mass, we learned that BMI and waist circumference are simple methods that correlate to the most accurate measures of body composition. While people are often interested in knowing their body fat percentage, it does not need to be a part of a comprehensive weight management program for the general population. BMI and circumference measures can be just as effective. Metabolic syndrome is a group of risk factors that increase your risk of heart disease, diabetes, stroke, and other chronic health problems. Obviously, having one of these risk factors isn't good, but when they're combined, they can wreak havoc. There are 5 factors that make up metabolic syndrome, and it is diagnosed when any 3 of the 5 risk factors are present. Let's look at the 5 risk factors. Abdominal obesity or waist circumference of more than 40 in males and 35 in females. Elevated fasting glucose greater than 100. Low levels of HDL or the good cholesterol, less than 40 for males and less than 50 for females. Elevated blood pressure at 130/85 or higher, and elevated blood fat measured by fasting triglyceride levels of 150 or more. Again, metabolic syndrome is diagnosed when any 3 of the 5 risk factors are present. The underlying causes of metabolic syndrome include overweight and obesity, physical inactivity, genetic factors, and getting older. Your activity in Module 2 is to assess your own body composition. You will find the Body Composition Assessment Worksheet and other tools in the Activities and Assessments tab for Module 2.